If you think you're struggling with TMJ pain, then you're in a good place to start, because we're going to talk about the symptoms of temporomandibular joint disorder. So some of the symptoms you can experience are jaw pain, which is usually located somewhere in this region. The pain can be deep inside the ear, so people will often complain like they have an earache. You can also have neck pain, shoulder blade pain, and sometimes the pain can actually radiate down into the arm or shoulder. You can have numbness, tingling down, and that's usually caused from a pinched nerve in your neck. And then you can also experience clicking, popping, grinding, clenching within your jaw. So if you're experiencing any of these symptoms, there's a pretty good chance you have TMJ pain. Most of our patients are told that they have a TMJ problem by a specific provider. It might be your dentist, it might be your ENT, your primary care doctor, an endodontist, but everything that you try to do for it seems to not help or get the results that you're looking for. You might have tried a bite guard, you might have tried some over-the-counter medication, you might have even tried prescription medication, and nothing seems to change. Your jaw's still clicking, you're still getting headaches, neck pain, shoulder blade pain. All those symptoms are persisting. And there's one specific reason why, and it's because you're doing things in isolation. You're doing something to address one part, but you're not addressing the whole condition. So temporomandibular joint disorder means that multiple things are involved, not just the temporomandibular joint itself. So most people will try these bite guards. Well, why isn't the bite guard working? Well, it's only addressing one component. The real secret to putting an end to jaw pain is to treat the jaw, the neck pain or shoulder blade pain, and then also the headaches that you're experiencing. If you treat all of those at the same time, then you get the best results, and it leads to long-term relief and does not come back. And that's what we do at Peak Physiotherapy and Performance. We get questions all the time about the Tmj anatomy. So what makes up the joint, and then how does the joint work? So we're going to talk about it. If you look here, the bones that consist of the Tmj joint are the mandible. Okay, so this is the bottom part of your jaw. And then it attaches to your skull way up here. Okay, and the attachment is via the ramus, which is this other bone here. So the joint itself is separated by a disc. When you open up your jaw, that disc is supposed to follow the jaw as it moves. In cases of popping, clicking, or catching in your jaw, the disc will actually pop out of place, and that's when you hear that click or that sound. It's the disc actually not being where it's supposed to. Some people will feel two clicks, so the disc will pop out of place and then it will pop back in when you close your jaw. This tells me that you do have some issue with the TMJ itself. Now, if we look back here, there's a number of different muscles. So we have your pterygoids, you have your pterygoid internus. There's also another muscle that goes over the top of here that attaches to the mandible called the masseter, and that muscle is responsible for closing your mouth. Now, that muscle will sometimes get tight. It will develop these muscle knots in it called trigger points, and we go in with dry needling and we will actually treat those trigger points directly. So a lot of these muscles are things that we target on a regular basis as part of our treatment. So if you're watching this video and you were hoping to get, 5 simple exercises or something like that that was going to get rid of all your TMJ issues, I'm sorry to say this, but that doesn't exist. And the reason being is because we actually had to develop a 5-step process or a framework to get these people out of pain, because this is not a simple problem. This is a complex problem involving several different body regions. And if that's not all taken care of the right way, at the right time, with the right stimulus, you will not get results. So here's what we've come up with. Our 5 steps to success for TMJ pain. Step 1 is educate the patient. Some of the education is going to involve what we call parafunctional habits, and it's going to be avoiding certain types of foods or certain things that can exacerbate or make the problem worse. Some of these other education topics will involve postural correction, different things you can do for your desk setup. We have to look at the whole picture, not just one thing. We will also use dry needling to treat some of the muscles that are inflamed or irritated, or some of the muscles that are just tight and clenching a little bit too hard. The one thing about clenching devices that you may have tried is they go in your mouth, but they don't actually stop the clenching. You're able to continue clenching, it's just not damaging your teeth. So we will actually get in there and use dry needling to treat those specific muscles. We then go in and we address the joint restriction. So a lot of times with jaw pain, one side of the joint itself will actually be tighter or stiffer than the other. And when you go to open your jaw, it will shift one way or shift the other direction. This is a problem and this has to be addressed. But if you address it too soon or too late, you don't get the result you're looking for. The joint restrictions also apply to the cervical spine or the upper back area. If those areas are restricted and not moving the way that they're supposed to, it will also impact your recovery for jaw pain as well. So we have to address all of it at the same time. We'll also do trigger point treatment. This may be by way of cupping, soft tissue massage, trigger point release, or we may combine some of that with our dry needling to treat some of those irritable muscles and those irritable tissues. And then lastly, we'll provide you with specific exercises. And these exercises don't just treat the jaw. They also treat the headaches, neck pain, shoulder blade pain, numbness, tingling. We have to address it all. And to this date, we have not found a provider who can incorporate all of those elements to get patients out of pain. So if you're in Central Ohio and you're struggling with temporomandibular joint pain or disorder, reach out to us. You can click the link below to schedule an appointment to talk to one of our doctors.